Were ancient Egyptians the first bone setters or the first chiropractors? When we think of chiropractic care or bone setting, it often evokes images of modern clinics where skilled practitioners use precise techniques to align the spine and alleviate musculoskeletal pain. But what if I told you that the origins of these practices trace back thousands of years to one of the world's most ancient civilizations? Yes, we're talking about ancient Egypt, a society renowned for its incredible accomplishments in engineering, astronomy, and medicine. This raises an intriguing question. Were the ancient Egyptians the world's first bone setters, or perhaps even the first chiropractors? The answer lies in the surviving records and depictions of their medical practices, many of which have been remarkably preserved. Ancient Egyptian medicine was sophisticated for its time, and their approach to healthcare extended beyond herbal treatments and spiritual rituals to include hands-on techniques that bear a striking resemblance to modern bone setting and chiropractic adjustments. The oldest known medical texts, such as the Edwin Smith Papyrus, provide significant evidence of the Egyptians' understanding of the human musculoskeletal system. Dating back to around 1600 BCE, the Edwin Smith Papyrus is considered the oldest known surgical document in the world, detailing various medical conditions and their treatments. This papyrus reads almost like a modern medical manual, describing specific procedures for treating injuries related to bones, joints, and the spine. Within its text, there are explicit descriptions of how to manage dislocations and fractures. For instance, there are instructions on how to manipulate dislocated vertebrae, a method that closely resembles spinal adjustments used by chiropractors today. The papyrus outlines detailed protocols for feeling the injured area, assessing deformities, and setting bones back into their natural positions. This form of manual therapy can be considered a precursor to both bone setting and chiropractic care, showcasing an understanding of the importance of spinal alignment and the correction of musculoskeletal injuries. The ancient Egyptians appeared to have a holistic view of health that connected the structure of the body with its overall function. They understood that if a bone was out of place, it could lead to further complications, echoing the modern chiropractic principle that misalignments in the spine can impact overall health. Their treatments included the careful use of pressure, traction, and repositioning of bones to restore normal alignment, a practice that is essentially foundational to both bone setting and chiropractic care. Interestingly, they also employed traction techniques, often using wooden splints and linen bandages to immobilize and align broken bones. Hieroglyphic depictions show physicians working with patients to extend limbs and manipulate the spine, suggesting that manual therapy was a valued component of their healing repertoire. The presence of these techniques points to an advanced understanding of the musculoskeletal system and a desire to use non-invasive methods to restore physical function. Beyond the Edwin Smith Papyrus, other evidence of ancient Egyptian bone setting can be found in the Ebers Papyrus, which dates back to around 1550 BCE. This papyrus primarily focuses on internal medicine and herbal remedies, but also includes references to treating orthopedic injuries and reducing dislocations. It includes prescriptions for pain relief, often combining manual manipulations with herbal poultices. The dual use of manual therapy and natural remedies implies that the ancient Egyptians recognized the importance of both physical and internal treatments in achieving recovery. Archaeological evidence also supports the theory that ancient Egyptians practiced early forms of chiropractic care. Skeletal remains discovered in tombs show signs of healing fractures that were properly set, indicating that those individuals received skilled treatment. The precision with which some fractures were aligned suggests not only knowledge of anatomy, but also a level of care that would have required practice and specialization. This hints at the existence of medical practitioners who focused specifically on bone injuries, much like bone setters throughout history. Moreover, the ancient Egyptians were not just concerned with treating injuries, but also with maintaining physical well-being, an approach that aligns with the philosophy of chiropractic care today. The importance of posture, physical alignment, and balance was evident in their culture. Physical activity, including wrestling and other athletic pursuits, was common in Egyptian society, and maintaining physical health was seen as essential for a fulfilling life. This awareness of body mechanics may have contributed to their interest in keeping the spine and joints healthy through manipulation and alignment. One of the most interesting aspects of ancient Egyptian medicine is that it blended physical treatments with spiritual and holistic practices. Physicians like Imhotep, who is often regarded as the first known physician in history, were not only doctors, but also high priests. Healing was as much about restoring spiritual balance as it was about physical treatment. This holistic approach to health, addressing both the mind and body, parallels modern chiropractic philosophies that emphasize the connection between the nervous system, spine, and overall well-being. It is also fascinating to consider how knowledge might have been passed from the ancient Egyptians to other cultures. The Greeks, who are often credited with advancing medicine, were known to have learned much from Egyptian practitioners. Hippocrates, considered the father of modern medicine, is thought to have studied in Egypt, and his teachings reflect an understanding of spinal manipulation and the importance of musculoskeletal health. This transmission of knowledge could mean that the foundational principles of bone setting and chiropractic care have roots in the Nile Valley. While it would be a stretch to label the ancient Egyptians as chiropractors in the modern sense, after all, they did not possess the intricate understanding of the nervous system that today's chiropractors do. Their practices certainly laid the groundwork for the development of manual therapy. They understood the importance of physical alignment, employed sophisticated techniques to set bones, and treated musculoskeletal injuries with skill and precision. In many ways, their contributions can be seen as an early form of the chiropractic and orthopedic practices we recognize today. So, were the ancient Egyptians the first bone setters or chiropractors? The answer lies somewhere in between. They were pioneers in manual therapy, using their knowledge of anatomy and physical manipulation to treat injuries and restore health. They may not have had the modern vocabulary or scientific framework we use today, but their practices were undoubtedly the precursors to bone setting and chiropractic care. In their careful attention to the alignment of bones, the manipulation of the spine, and the holistic approach to well-being, the ancient Egyptians laid the foundation for centuries of manual medicine, a legacy that still resonates in the practices of today's bone setters and chiropractors.